I'm Dr. Rick DeShazo. Thanks for joining us for this special edition of Southern Remedy. Our mission here is a healthy Mississippi, and we work hard to address all of those topics that affect the health of Mississippians. One issue has people all over the state talking: Medicaid. It's complicated, it's wonky, and you might think it's something for politicians to figure out. But you're wrong. From the very basics on how it works to the way proposed changes could affect it, there's information you need to know.
It has been one of the most contentious topics in recent Mississippi legislative history: Medicaid and Medicaid expansion. But what is it, and how does it apply to you? Right now, Medicaid provides health insurance coverage to over 600,000 Mississippians. These people usually are, very simply put, disabled, young children, or pregnant women. The major debate right now is whether or not to open the program to potentially 300,000 more participants.
Medicaid provides very broad coverage, and for those beneficiaries, you basically can't buy a policy as comprehensive.
Medicaid covers just about everything you might need if you're sick and unable to get around easily. Things like doctor's office visits, hospital care to prescription drugs and eyeglasses, even home care and transportation to and from doctor's offices if you don't have a way to get there yourself, as long as you fall into certain categories.
Right now, in order to be eligible for Medicaid, you have to meet both income criteria and categorical criteria. And so you need to be very low income and in addition fit into a category. So those categories are children, pregnant women, and some parents. The eligibility levels for adults are quite low, both nationwide and in particular in Mississippi. So, for example, in the state, if you're a parent and you're making more than half the poverty level, which is, the poverty level is about $11,000 a year, you are not eligible for Medicaid coverage. If you are an adult without children, you are ineligible for coverage regardless of your income.
Currently, over 600,000 Mississippians get their coverage through Medicaid. That's 1 in 5 people in the state. And because of that, Medicaid is a huge source of revenue for Mississippi.
The federal share of Medicaid cost is determined through a formula that's set in law. And basically, the way the formula works is the lower the state's per capita income, the larger the share the federal government plays. So in Mississippi right now, it's close to 80% of the costs are being paid by the federal government. It goes to providers, it goes to hospitals, it goes to physicians, it goes to nurse practitioners, it goes to clinics, all of the healthcare providers that are going to see these individuals. Right now, when people don't have insurance coverage, they either go without services, most typically, or when they do need to seek services, are faced with either paying it out of pocket or simply are unable to pay that bill.
In 2010, the Affordable Care Act passed in Washington, allowing Medicaid expansion across the country. It was both applauded and reviled. The law was challenged in the Supreme Court, and in 2012, the Supreme Court upheld the act, with a few caveats. Previously, the law said that any state who did not expand Medicaid would be punished by having all of their Medicaid funding taken away. This part of the law was struck down by the Supreme Court and opened the door to the political shootout that's been happening in Mississippi and across the nation since. Another sticking point: disproportionate share hospital payments, or DSH payments.
Uncompensated care is paid for by these disproportionate share hospital payments, which are set to be reduced, not entirely eliminated, but reduced under the Affordable Care Act, regardless of whether the state expands. That reduction over that same 10-year period I talked about is about $56 billion across all states. It's still to be determined what the impact will be on Mississippi.
CMS has not yet passed rules and regulations in terms of if they're going to try to take away the DSH payments. We'll have to wait and see if they do. Perhaps they're going to do that soon. Perhaps they're going to be 3 months from now. Perhaps they're going to be a year from now. But what they have said is that DSH payments will continue this year, and as long as that is the case, I am going to oppose any Medicaid expansion in Mississippi.
Under the new health care law, there's some things that are favorable and there's some things that are unfavorable. There's no choice about all the unfavorable things. That's going to happen. From the perspective of the provider, the question is, are you going to keep us from getting the favorable things that are supposed to balance off the unfavorable ones? I think we need to listen to what the providers are telling us.
Dish payments in Mississippi are crucial to the doors staying open for many hospitals, in particular rural hospitals, where the population is often impoverished and uninsured. The debate over the fate of the dish payments is often where the debate over Medicaid expansion hangs up. In theory, if Medicaid in Mississippi were to be expanded, there would be far fewer uninsured people going to doctors and hospitals, thereby eliminating the need to compensate them with dish payments. Instead, under the Affordable Care Act, that money used for dish payments will be rolled into overall funding for the program. If Medicaid is expanded in Mississippi, around 300,000 people are expected to be added to the rolls, taking that 1 in 5 number mentioned earlier to 1 in 3. And the limitations on who can actually get Medicaid will be dramatically different.
The expansion will get rid of those categories, and so it will only be based on income, and it will cover everyone up to 138% of the poverty level, so about $12,000, $15,000 a year, depending on how large their family is.
That would be almost 1 million people on Medicaid in Mississippi, a number that makes politicians very nervous.
At some point in every society, tough decisions have to be made. Do any of my colleagues, do I believe that people should go without health insurance or go without health care? No, that's not what we're saying. But we're saying likewise they shouldn't go without food, and they shouldn't go without other amenities of life. But at some point we have to admit to ourselves, if we are a fair republic, that there's simply no way to pay for every wish and want and every desire. It's a practical impossibility.
Anybody who cares about health care and the ability to get adequate care for your family or anyone else without having to go to an emergency room ought to try to support the expansion of Medicaid.
A lot of debate still remains on the topic of expansion, but before our lawmakers even get there, there is an issue of the current Medicaid program. At the moment, it's set to expire on June 30th, and the people who suffer the fallout can't afford to pick up the pieces.
This is Lucky the Cockatiel, one of the most popular residents of Community Place, a nursing home facility in Jackson, Mississippi. Lucky's one of the few residents here who is not supported by Medicaid.
Community Place is a skilled and long-term care facility that was established in 1932 by 3 ladies that saw a need in Jackson to care for those that had no one to care for them. We're the only nonprofit nursing home in Jackson.
Currently home to 54 residents, Community Place can take up to 60 people, and 95% of those people are on Medicaid. That's right, Medicaid people.
Are the average people who qualify for Medicaid hobos or people who have never done anything? What is the average Medicaid person that you see here?
It's middle income America. It's people that they've worked all their life, or they've worked up to the point of a catastrophic event where they can't care for themselves anymore, and they don't have the money to take care of themselves. That's what a lot of the Medicaid patients are coming from.
Currently, there are over 600,000 Mississippians on Medicaid, and of those, around 17,000 of them are nursing home patients. According to the Mississippi Division of Medicaid, over 75% of those 17,000 Mississippians living in nursing homes rely on Medicaid. And this is just one of the reasons why the failure to reauthorize Medicaid during the 2013 legislative session is such a political hot topic. Being linked to Medicaid expansion didn't help either.
The Democrats in the House voted to kill funding for Medicaid. Now, they can make any excuse they want to. Anyone can try to spin it any way they want to, but the truth of the matter is, twice they voted to kill Medicaid. When you vote not to fund an entity like Medicaid, that means you want to do away with it.
The governor needs to step up to the table, and there's plenty of, if he wants to call that blame, there's plenty of blame for him to take. Then it's all in the governor's court. It's 700,000 people who are on the Medicaid program now, 300,000 working families that could be if the health care was expanded, and it's $30,000 a day to come back to special session, and that's his choice, and that's Republican leadership's choice.
I think between now and June, Democrats across this state and every Democrat in the House voted to do away with Medicaid, and they're going to be asked when they return home why they did that. Someone's going to say, why do you want to take my mother out of the nursing home to expand Obamacare? That's a simple question I hope all Mississippians ask them.
Medicaid program is not going to be cut down, not going to be stopped in the state. When you've got 800 million state tax dollars going to get your match, it's not going to happen. This is a multi-billion-dollar program with thousands of jobs, but the governor also has at his front doorstep right now the opportunity to lose billions of dollars for this state and thousands of jobs within the next 90 days.
It's a political game of chicken that's been going on for the last several months, and so far there have been no winners. And unless Republicans and Democrats come to some agreement, there will be many losers, especially those living in places like Community Place.
95% of our residents are on Medicaid at Community Place. If we did not have the funding for Medicaid, we would not continue to exist. These people would have to find another place to live.
And how much is that funding? How does it cost a taxpayer to help these residents live?
It costs approximately $185 a day, but it can cost more than that to come in privately. So when you take $185 a day and you multiply that times how many days there are in a month or a year, it can add up to be quite substantial.
And believe it or not, that's cheap. Since Community Place is not for profit, they charge everyone the same $185. Private payers, Medicaid, everyone gets the same low rate. At other facilities, prices can run much higher, up to $230 a day. Do the math. That's almost $7,000 a month.
The money that comes to nursing homes from Medicaid the majority of it is spent on the labor, on providing jobs, a lot of jobs, for people that come in and care for these elders that have no one else to care for. So that's where the majority of the money goes. We also use that money to provide for the light bill, for the food, for the maintenance of the building. We provide laundry, we provide housekeeping, we provide everything that the patient would need. We also pay for medications that may not be paid for by Medicaid or Medicare.
And all these things are paid for at a rate that's not quite up to 2013 levels either.
It's being funded at cost, at 2008 cost, and then it was inflated for 2009 and 2010, and then it was stopped. It's important that people understand that nursing homes need to be able to exist at our current costs and what it costs to actually run a nursing home. And that's something that we count on our legislatures to consider as they make the decisions that they do. When the Medicaid funding is frozen, or when the Medicaid funding is not there for nursing homes, then you have to cut corners. And sometimes that means cutting the staffing. A lot of times it does, because the biggest expense we have in nursing homes is the labor. So that means that we have to cut the staffing, which decreases the quality of care that we're able to give to our elders. It makes it really tough. Administrators have a very tough job in deciding how to balance that, how to make sure that we can give as much as we can to the patients and yet be able to keep the doors open.
Regardless of the debate at the Mississippi State Capitol and elsewhere in the country, the days and weeks go on at Community Place. They can't focus too much on the politics of the issue. Instead, they focus on the real people and real lives.
These are people that have spent their life growing up through the times that we have been in and more, watching what's happened all through our lives and beyond, and have worked very hard in tougher times than we have, and they need to be cared for. And that's what Medicaid does. It provides care for those people in nursing homes.
From the nursing home to the State House we go. The issue can almost be divided down party lines. During the 2013 legislative session, Mississippi's lawmakers were intent on towing those party lines.
It's almost a cliche that a bad sports writer might take too far. In this corner, we have the Republicans. Over in that corner, the Democrats. But we're talking about the health and lives of real Mississippians. So puns and jokes will have to wait. From the very first days of the Mississippi 2013 legislative session, Medicaid and Medicaid expansion have been a hot and divisive topic.
We can't afford it. I mean, all the information I have received indicates that it is an enormously expensive undertaking, and my consultation with the governor, lieutenant governor, there is no appetite to expand it.
That seems to be general consensus coming from the Republican Party, what they want to deal. They don't want to deal with it at all. Democrats, we want to deal with it.
The battle began early when the House voted down a Medicaid reauthorization bill because it did not include expansion.
Well, you do what you have to do up here, and we have enough numbers to do that. It was a protest vote to say, Republican leadership, we respect you, but we do not respect the fact that you're not giving something that will impact Mississippi economically and greater health outcomes exponentially, the chance to be debated. And we had to do what we had to do, and we can kill the next bill if we have to.
And so the Democrats did. In the meantime, the Senate passed its own version of the bill. But this one did include the option of expansion. But more political games were afoot. And instead of the bill going to the House Medicaid Committee for review, Speaker Philip Gunn sent it to the House Rules Committee, where it eventually died a slow death.
We're not going to engage in a debate on a bill that's headed nowhere. It is not good stewardship of the time or the money that we have and the short amount of time that we have down here. It would be done simply for political showmanship, and I'm not in the business of political showmanship. We're not playing politics down here. We're not going to engage in a debate that would end up and result in no bill being passed. The vote that we had on appropriation bills, the Democrats were 21 votes short of passing it. So the bill cannot pass.
We also have heard, look, the House Democrats don't have enough votes to pass expansion of Medicaid for 300,000 working families, so we're not going to take it up. But I pose this question, if we don't have enough votes to pass it, why not let us have a vote on the floor and just go ahead and beat us? Just go ahead and beat the Democrats and the working families and be done with it.
Sitting down one-on-one, members of both sides of the aisle bring forth excellent points, both for and against expansion. First off, there is the issue of straight-up reauthorization, which is continuing the Medicaid program that already exists. It must be reauthorized by July 1st, or over 600,000 people in Mississippi will suddenly be without health insurance. And simple reauthorization comes with mandated changes as well.
Under the Affordable Care Act, we're going to add about 80 to 90,000 people that are mandated by the Affordable Care Act.
That's almost 100,000 people who will be added to the Medicaid rolls, with or without expansion. According to Representative Howell, another 25 to 30 staff will need to be hired at the Division of Medicaid to help support those extra people, so there's more cost to the state. But on to expansion. We spoke with Representative Bobby Moak, the Democratic caucus leader who has been the spokesperson for the party on the issue, as well as to Senator Chris McDaniel, who often serves as a moral leader for his party.
And we do have the opportunity to expand our Medicaid rolls under the Affordable Care Act. On the other hand, the question is, where's the money going to come from in regards to state funding?
And those of us in elective office, that's got to be the first thing that you think about. What do the citizens of the state need? And can we do it? Can we afford it? Can we make it happen? So there's some 300,000 working families that need it. That's why we should even consider doing it, because it's good public policy.
You know, it's one thing to believe the federal government. It's quite another to really believe the federal government. And they've given us some assurances over the next decade. But bear in mind, these assurances coming from a Congress that right now is dysfunctional. Not much is happening. They can't agree on much of anything. The reality is Mississippi has to have some very firm answers, not suggestions and not recommendations, but firm answers on what the future holds.
Our institutions of higher learning, our colleges have put together a study and has said, look, we're going to create throughout the state 9,000 new jobs if we have this expansion. And look, that's just not doctors, just not nurses. That's the receptionist, that's the bookkeeper, that's the folks who clean up the offices, that's everybody.
Okay, no middle ground there. What about reaching a compromise? Is there a way for the parties to meet in the middle?
I'm trying to make dispassionate decisions on issues that affect my client and others. I'm not worried about a crisis scenario or the fact that the end of the world is approaching. I don't know that the end of the world is approaching. Since I've been here 6 years, the end of the world approaches about 15 times a session. It just depends on the issue.
Democrats have dug their heels in because this is an issue that is probably one of the biggest of our generation. The money, let's follow the money, number one, that comes into this state is probably the biggest influx of money we have seen in quite some time. The job creation that comes along with that is tremendous, and not to mention caring for our people in the state and giving them health care. So we have dug in as a group, but we have also individually said this is the issue, this is the biggest issue that is important to us, and we have just simply gelled around this issue because we know how huge it is. And we don't think we're standing out there alone.
If there is really indeed a crisis scenario, if the end of the world truly is approaching, I would think at some point cooler heads would prevail. People would get together and they would find out the answers, the same way we found the answers in all the crises that have always affected our country. What I don't want to do is to rush into something simply because it's politically expedient. What I don't want to do is make a decision that impacts the future of this country or the future of this state because it feels good.
Speaking of cooler heads, Representative Bobby Howell, himself a Republican, does not rule out the option for expansion, but does call for patience and caution.
You don't have to do expansion as this year. You could go to like 2017 if you were going to go into the expansion. If you found that facts and practical sense dictated it, it just doesn't have to be done right this minute. And I think we'd be better served to learn from some of our sister states and stuff to see how some of this moves forward.
And if that doesn't make sense, Representative Howell puts his feelings about Medicaid expansion in an easier to understand way.
Like going to a car dealer and you don't have any money in the bank, and they say, well, we'll give you this car with $50 down, and the first payment's not due till 6 months, but are you going to have your payment in 6 months is what you have to ask yourself.
While the wait and see happens at the Capitol, hospitals in the state are preparing for crisis mode because no matter what decision our lawmakers make, the effects may be hardest felt by hospitals and ultimately the patients. Across Mississippi, you might be hard-pressed to find anyone who really understands the intricacies of Medicaid and Medicaid expansion. It's not a topic that usually comes up at the dinner table. At the Mississippi State Capitol in Jackson, it was one of the most talked about things at the 2013 legislative session. But outside the State House, there are some people taking notice. People in Mississippi have a great deal of concern about Medicaid expansion, especially Mississippi's business people. And the business people who run Mississippi's regional hospitals are especially concerned because healthcare politics can mean life or death at regional medical centers like Delta Regional Medical Center here in Greenville. Delta Regional Medical Center is huge for the Delta and Washington County in particular.
In Washington County, we're the largest employer. We employ about over 1,000 people.
It's a regular rural hospital in a town where most people know most people, and you can count on your neighbor for help in times of need. But according to Stancil Harvey, CEO of Delta Regional Medical Center, there may be no one to help soon, and it's all because of the debate over Medicaid expansion.
Effective October the 1st, we're going to get a $5.6 million reduction in our disproportionate share payments. Without expanding the Medicaid rolls, which we would pick up around, we're estimating $4.7 million, without expanding those rolls, that leaves us with a $5.6 million hole to fill. And unfortunately, since our entire profit last year, which was a very good year of $2.9 million, it doesn't take a genius to figure out that if you made $2.9 million and you take a $5.6 million cut, you're in the hole.
Harvey and Delta Regional Medical Center is in the same spot as many rural hospitals in the state, trying to determine just how bad things will be with or without Medicaid expansion, and trying to figure out how to survive regardless.
About $350,000 per day is what it cost us to keep these doors open. And so if I have a $5.6 million reduction in payment with no additional pickup from the expansion of Medicaid, we're going to have to do something with the services that we provide.
Meaning something has to go, whether it's people or services provided at the hospital.
You could eliminate your education budget. You could eliminate a number of other little minor things. But the reality is, if you're going to make any changes and you have to take out that large of amount of money, it is going to impact the number of employees.
It's also going to affect the health of the community the hospital serves.
If we're going to take this big of a monetary cut, then there are just some service lines that we're not going to be able to provide. So depending on what those service lines may be, they're just going to be things that are healthcare needs that we are not going to be able to meet in Greenville. You'll have to travel for your care, and a lot of patients here don't even have cars. They're not going to be able to go anywhere else to have their needs met.
Pacemakers with defibrillators, these little devices cost $28,000. We don't get paid that for the entire stay. So the question's going to have to come down, do we continue to put in pacemakers? Probably not. So we may have to reduce a lot of the services that this area of the state is used to getting here locally. We may have to curtail those services.
And besides the health effects on the community, there is the financial concern. If the largest employer starts laying off people, or worse, shuts down, you will see the effects elsewhere.
These are well-paying jobs. These are not minimum wage jobs. They're jobs that come with benefits. And so that money then circulates through the whole economy of the community.
It's less people buying cars, less people buying insurance, less people going to the movies, less people going out to eat. It has a major cascading effect. So when you're the largest employer in Washington County and in the Delta, as far as healthcare goes, any kind of change or reduction in what we do as an industry is going to have very negative impacts to the community.
Currently, over half of the hospital beds in Mississippi are in rural areas that are anxiously awaiting the political decisions to be made regarding Medicaid and Medicaid expansion.
I choose to live in Greenville. I love the Delta, but I don't want to live in a place where I can't take my child to the hospital for a needed service. If my child's out climbing the tree and breaks her arm like she's done, I want to be able to take her to the local orthopedist and get it fixed up and move on. We all want what's best for our children, and our hospital is the lifeblood of this community, and if we don't have the hospital here, then I just see this community drying up. This is not a rich area, and we see patients that are really sick. If you look at the health statistics, we're #1 in heart disease and diabetes and everything bad, and these patients don't have anywhere to go, and if they don't have the service here, where are they going to get the service?
Care that's not provided here is simply done without.
The debate over Medicaid continues across the country and especially here in Mississippi, as hospitals work to keep doors open no matter what comes.
Just absorb it as much as we can. At some point, it comes to the point where we can't absorb it any further.
So, to expand or not to expand, that is the question. There isn't a simple answer, not from the financial point of view or the political point of view. It's up to you, the Mississippi resident, to make a decision on where you stand and to decide how either option will affect you. We hope this information will be helpful as you go through that process. I'm Dr. Rick DeShazo. Thanks for watching.